goodness, where did my ball go? Okay, I found my ball. Welcome to my channel where we talk health, fitness and medicine to help you reach your highest potential. Today we're going to talk about the top exercises to help with your shoulder pain. So we've got the scapula and the humerus. You might have heard your doctor say before that the shoulder joint is like a golf ball on a tee. So it's as if this is your scapula and that's the humerus. Now in order to stabilize this, you've got structures around it such as ligaments, your labrum, your capsule, and your bones and your muscles to help keep this in position. There are so many causes of shoulder pain. For example, there can be a nerve that's being impinged in the neck and causing radiating pain down the shoulders. Number 2, there can be a rotator cuff problem, such as a tendinopathy or a tear. Number 3, there can be a shoulder instability problem causing the pain. Now, whatever the cause of your shoulder pain is, these exercises that I'm about to show you are one of the best exercises to help you with the pain. Now, before we dive into the exercises, there are a few foundation knowledge that we have to cover. A lot of people focus their shoulder rehab around band work, working on their rotator cuff, and wonder why they are not improving. A lot of people underestimate the importance of having good scapular control and scapular stability. Dr. Dalton, one of the sports physicians, gave me this analogy. Your shoulder joint is like a crane at a construction site. The scapula is the base of the crane, and the humerus is like the jib of the crane. If your base is not strong, then this might topple. Therefore, it's so crucial that you also address your scapular orientation and the strength around your scapula when you look at your rotator cuff. Alright, now we've covered that, I'm going to break the exercises up into 3 parts. Part A, rotator cuff. Part B, scapular control. Part C, mobility. Now, what are the rotator cuff muscles? Your 4 rotator cuff muscles are supraspinatus, infraspinatus, teres minor, and subscapularis. Now, let's dive a little bit about the shoulder blade. When someone's shoulder blade is tilted forwards, that reduces the space between the scapula and the humerus. And whenever someone abducts their arm or lifts up their arm, that causes impingement. Compared to someone who has good scapular positioning, that space has widened out now and it makes lifting my arm so much easier. So on this model, if someone's shoulder blade is tilted forward, it narrows down the joint space here and that causes impingement of the shoulder. When we talk about scapular positioning, there are few causes that cause the scapula to be at a suboptimal forward tilt position. So we talk about tissue flexibility and also muscle performance. When it comes to tissue flexibility, we have the scapular muscles or muscles around the scapula. Pec minor, levator scapula, and the rhomboids. Especially the pec minor, that tends to get quite tight. So I'll walk you through some mobility work that we can do later on for the pec minor. The capsule, so the shoulder joint capsule itself, can also affect flexibility. Muscle performance, here we talk about control, which is your neuromuscular coordination and the way you move your muscles. And we also talk about strength. We are going to focus on the trapezius muscle. Your trapezius muscle has 3 parts, the upper, the middle, and the lower. In order to correct the tilt and also have a stable scapular positioning, we want to focus on the middle and the lower trapezius. In this video, I'm going to show you the best exercises to help activate the middle and the lower trapezius to correct that tilt. It's based on EMG studies that have been done on the muscles. All that being said, let's dive into the exercises. The first exercise is external rotation of the shoulder. You want to keep your elbow next to your body and keep that elbow fixed to your body, and just externally rotate the band outwards. Now it's so important to keep your elbow right next to your body. Second exercise are internal rotations. So you're going to go internally now. Start from an externally rotated position and then pull it into your body. Alright, the next one, we are going to lower the band down. And then we're going to raise our hand up like how you do a lateral raise. But we do not want our hand right next to our body. We want it at a 30-degree forward angle. So remember, your hand is not directly next to your body. It is forward at about 30 degrees. Now let's move on to the fourth exercise. We are going on to the bed or the floor or mat. We're going to lie on our stomach and slowly raise our palm towards the ceiling or the sky. Now we want to activate the middle and the lower trapezius in this one. And the fifth exercise, we're laying on our side. Again, stabilize your elbow right next to your body, and we're going to externally rotate. So each of the exercises that I've demonstrated, we're going to do 3 sets of 12 repetitions. Alright, now let's stretch out our pecs. So you want to lean maybe against a doorway between your doors and really hold that position for at least 30 seconds. Feel the stretch.